the goal is for this this education to be accessible to everyone and anyone who wants it. And so that really is the goal here. And I feel like when someone picks up the app, it's, oh, okay, yeah, I can start to look for dryness. I can start to look for that stretchy, slippery, clear. Oh, okay, like, yeah, bleeding, I understand what a light day is or versus, spotting.
The restoring of fertility is like that's the most like sensitive biomarker, right? Because if you're sick, what's the first thing to go? Like your fertility, it's the most like sensitive system that your body has, and rightly so, it shuts down as something is not working properly. That can be like the best sign of chronic disease though, starting in the body. So we really try to get to people earlier in life, or really any time in life, but especially the younger populations, when they start to see issues in their cycle, like in adolescence.
Welcome to the Truth and Fertility Podcast. I'm Haley, wife, mom, and a fertility charting instructor, here to teach you the undeniable truth about your fertility. So let's get started. Welcome back to the Truth and Fertility Podcast. Today I'm sitting down with Emily Cosgray and Emily Bostard. They both represent FEMM Health. FEMM is fertility education and medical management. And I'm really excited to chat with them today because FEMM is just another option of getting good root cause medicine, restorative reproductive medicine, which I am all about. I represent more of the Creighton and technology world of things. FEMM is another world that offers that restorative reproductive medicine as well. So I'm sitting down with both Emilys today who are representing FEMM. We're going to chat all things FEMM, talk about what it is, what it offers, and how you can be involved in it as well. So without further ado, I will pass it on to whichever Emily would love to start and introduce herself.
Yeah, hi Haley, thanks for having us. My name is Emily Cosgray. I am a nurse in Houston, Texas. I've been working at the hospital for about 5 years, and last year I transitioned to start working with FEMM on their telehealth platform. I am also a FEMM instructor, so I'm trying to do that on the side as well.
Yeah, my name's Emily Bostard. I'm the clinical care manager with FEMM. I'm based out of Columbus, Ohio, and I've been on the platform for just over 3 years now. And yeah, it's been great. I'm a FEMM teacher as well. I believe I got trained in 2020, and yeah, I love to do that on the side as well. Yeah, so thanks for having us, Haley.
Yeah, thanks for being on. Okay, let's just start out with the basic question of what is FEMM for listeners who have absolutely no idea what we're talking about.
Yeah.
Do you want to go ahead, Emily?
Sure. Yeah, I'll take this one. You can add on. Yeah, FEMM is a women's health organization, really out to educate women. For them to help them answer the question even of, what is normal, what is healthy for my body, how to identify ovulation and why that's a vital sign of health. And yeah, like you mentioned, it stands for fertility education and medical management. And so we have, part of our organization that is education based, teaching, really whoever wants to teach them about their cycles and how to identify those biomarkers, and then we have medical management for women who need that support as well. So
and just to add to that, we try to reach international, like all different countries. We especially focus on trying to reach people like the younger crowd, and yeah.
Okay. Yeah. So I know you guys are most known, I think, for your app. Your app is phenomenal. I think it's one of like the best fertility. There are hundreds of fertility apps out there, and I usually recommend like 3. And yours is one of them. Because your guys' app is phenomenal. So is FEMM, I guess one of the questions that has been on my mind for a while is trying to understand, okay, is FEMM a method of fertility charting in and of itself, or is it offering just a platform to chart whatever form of fertility charting you use? Does that question make sense?
Yeah, that's a great question. Okay. It is a method in and of itself. So we do have an online course for anyone who's interested can become trained to be a FEMM instructor. And so there are courses, and then you have to do training of your clients and go through review of that, probably similar to other programs. Our main focus is cervical mucus, but we do also use LH and just a little bit of basal body temperature as well. So that, yeah.
Yeah, I
Okay.
believe we consider ourselves somewhat of a sympto-hormonal form of fertility awareness methods. Yeah, pairing the cervical mucus with the LH biomarker, just like Emily mentioned, and yeah, just a little bit of training on the BT there as well.
Okay.
Yeah, but
Okay.
yeah, our app is very popular. Yeah, I mean, it's free. I mean, people love that if nothing else, but it really allows you to plug in exactly what you're seeing, and instead of being, the problem with some of the other apps are they, assume things for you, whereas you get to put in your own observations, which is great.
Yes. Yeah. That is, I could go on like a whole soapbox about apps, and which is why yours is like one of the only ones that I actually recommend, because so many of them are just using like a calendar rhythm algorithm to tell you when you're ovulating, which we've known for decades now is not real and it's not true. And so, yeah. So I think that's great that your guys' app is actually just taking in that information and using the scientific information from it. So you said that can you use FEMM with just cervical mucus, or does it require the addition of the LH or the basal body temperature?
Yeah, you can definitely just use it with the cervical mucus. That is the primary biomarker. I would say LH is more of like a supporting marker, especially just to help confirm women's observations.
Okay,
Yeah,
gotcha.
absolutely.
Okay, and is that something that when you want to learn FEMM, how do you do that? Like, is it through the app? Can you get an instructor through the app? Like, what does that whole process look like?
Yeah, we have a whole group of women who just stumble upon the app, and they get to kind of figure it out for themselves. There's a lot of direction on there, kind of different keys to help you kind of self-learn. But then there's a whole nother group that have maybe found a FEMM teacher. You can also find one through the app. You can get support through there, but maybe they're working with a FEMM teacher, and that's great as well. So definitely those couple of options. And as you're working with a FEMM teacher, we have a certain curriculum that we run you through, a series of really 3 sessions, if appropriate, depending on the age. Yeah, we also have teen FEMM for grades 6 through 8, and so just age appropriate material. For all ages, really. Yeah.
Okay. So if I was somebody that I wanted to learn how to chart quickly, but still correctly, could I just use the app and figure it out for myself, or would it be best to hire an instructor to kind of walk me through that?
I would say we definitely recommend working with an instructor. That's the best. You're going to get all of the pathophysiology behind it. We talk a lot about the hormones in the brain and what's really happening inside your body and how it's impacting all the different body systems. That's a really big emphasis. But certainly using the app, there is so much information embedded in it that you could use it on a very surface level, for sure.
Okay. Is there a different, I don't know if you guys would know this off the top of your head, but I'm just curious to know like the efficacy rates of using it for family planning if you're using the app alone, just kind of on a self-taught base versus using it like learning with an instructor. Like where do you guys go about with like making sure people are educated about like, okay, your efficacy of being self-taught, right? Versus the efficacy of using it to actively or to effectively be able to avoid or achieve pregnancy with an instructor. Do you guys have anything to say about that?
Yeah, I think that's probably where, if you're wanting to use this for family planning, I mean, really, once women are given the tools, whether it's through the app or then even more in depth, certainly with a FEMM teacher, it's amazing how we are then able to notice those signs in our body, like, oh, okay, cervical mucus. Okay, now I'm seeing this, and I'm seeing this pattern now, and so it's really accessible knowledge for us to grasp our heads around as women once we kind of are given the maybe terminology and what that should look or feel like. I think when you're wanting to use this to achieve a fertility goal, yeah, probably working with a FEMM teacher could, help you gain some confidence, if nothing else. But yeah, it really is so tangible. It doesn't have to be this type of thing that's out of reach for women. It's, just getting to know our bodies and its own signs. And it's really beautiful when that kind of comes together and it clicks. I know that was the case for me when I was working before I was a FEMM teacher, I was someone's kind of guinea pig, I guess, doing their case studies as they were becoming a FEMM teacher. And my mind was blown. I, didn't know about cervical mucus. I didn't know, about any of these cycle patterns that now I'm aware of with, just really minimal, time and time to take to understand it all. So anyways, I'm not sure of like a specific an efficacy rate number for you, but that would be my take on that.
Okay. Yeah. And actually kind of I wanted you guys to also go into your stories of like, how did you come across FEMM? What made you want to become FEMM instructors? If either of you want to start with that, I'd love hearing like the story of like the passion behind your project, right?
Yeah. Should I start, Emily?
Yeah.
Yeah, I would say that I've always been very interested in this topic. That's why I became a nurse. And I kind of was like, yeah, someday down the road, I want to do something with this. I wasn't really sure how to apply it. And it wasn't until I was at a bioethics conference and I was listening to, she's actually a nun, but also a medical doctor that was trained in the FEMM protocols. And she's also an alumni of my University of Dallas. And she was just talking about how she used the FEMM protocols to heal her patient. And I was just so blown away and so impressed at the results that she was showing. So I went ahead and became a FEMM instructor. And then I went to a medical management course and audited in person in Ohio. Because it's intended for physicians to get credits and become certified in FEMM, but it's very much open to anyone who's just eager to learn and soak up the knowledge to audit it for a reduced cost. So I went ahead and did that, and I was just blown away by the people that I met there, and also just the protocols were just something like I'd never heard of before, and personally brought a lot of answers for my health journey as well going there. And then eventually I was able to start working with a telehealth platform. Yeah.
Okay.
Yeah,
Emily, other Emily. How about you?
Yeah, this is our day all day, every day. Oh, Emily, which Emily? Yeah, it's great. But yeah, before FEMM, I was working at a pregnancy center. And so I was a center coordinator, at a center here in Columbus, Ohio. And FEMM is I believe, still their method that they offer for birth control, basically non-hormonal birth control. And so there was a FEMM teacher phasing out and they needed a new one, and I was like, oh yeah, I'll learn about that. And I didn't know what I was getting myself into when I was first starting the training, but because the FEMM teacher training course, like Emily mentioned, really anyone can take the course, but it's a commitment. It is like you really do feel like something when you're wrapping up with it, and you feel very equipped to then equip other women to teach them about their physiology. But so I became a FEMM teacher and was using that and working with that at the pregnancy center, and then also teaching women in other settings, I suppose, too, like at coffee shops, juice bars, and that sort of thing. And then this opportunity to work on the platform and this clinic manager role came available, and I felt like I didn't know too much about the medical management side at that point, and this is my opportunity to really get into it and understand that portion a bit more. And what a gift that's been too. So
Yeah, that is honestly what I love just about really any sort of fertility charting is that, I mean, we started out decades ago with using this for family planning, which is phenomenal and has been such a gift. But we can't stop there. And I feel like now we're starting to realize, like, oh my word, the amount of information that we can gain just from a woman looking at her cervical mucus. Like, just that alone, we know so much about her hormones, about her cervical, like we know so much about her, and we can treat her. I say we, I'm not a doctor, but really smart doctors can treat her well and actually get to the root of what is going on. And so that is what I am most passionate about is teaching this for the sake of medical management and really helping women dive into, what is causing maybe their irregular cycles or painful periods or whatever they're experiencing, and actually helping them get to the root of that. So let's dive into that, because I know that is like FEMM's bread and butter, is like, I mean, it is literal medical management. That is what you guys are offering. So gonna talk about that. I know, Emily Cosgray, you mentioned something about protocols that you learned when you were learning about the medical management side of things. So what is that? What are the protocols? What does that look like?
Yeah, well, just a disclaimer, I'm not a medical provider either, but I will do my very best to give you an overview. Um, let's see here. So we have what we call the basic hormonal profile. So that's a standard set of labs that we draw on a given patient who comes to us. Often they're charting their cycle and looking at that cervical mucus, and they find that something's not quite right. And whether it's the app or their instructor tells them you need to seek medical management. So we do, I think it's like 16 labs in general, sometimes more, sometimes less. But that gives us a good overview of the main hormones that are really impacting the cycle. Dr. Pilar Vigil is the head of the research institute that our protocols are based upon, out of Chile, the Reproductive Health Research Institute. And something she always says at the courses is, let's paint the world. So PAINT, the P is for prolactin, and then let's see here. I'm gonna blank on
androgens.
I was gonna say, is it androgens?
I was looking at androgens, yeah.
And then IN is for insulin, and then T for thyroid. So those are often like the main things that we see women for. And a lot of times in this country, a very common problem is the insulin resistance part of it, the metabolic issues. So a big focus on the platform is really preventing chronic disease. We see the restoring of fertility is like that's the most like sensitive biomarker, right? Because if you're sick, what's the first thing to go? Like your fertility, it's the most like sensitive system that your body has, and rightly so, it shuts down as something is not working properly. So that can be like the best sign of chronic disease though, starting in the body. So we really try to get to people earlier in life, or really any time in life, but especially the younger populations, when they start to see issues on their cycle, like in adolescence. And that can be a sign that maybe pre-diabetes is starting, and it may not be significant now, but it's going to have a huge impact on cardiovascular health and bone density, and brain health is a really big one as well. So, and then, so I spoke on the BHP, which is our labs that we draw at the beginning of the cycle, usually on day 3 or 4 or 5. And so that can be really helpful for patients who are coming to us that are sick. And so they don't always know exactly when they're ovulating because it's unclear. So that can be a great way to kind of get the door open for them. And then we also do a basic ultrasound in the pelvic area, whether transvaginal or abdominal. Transvaginal is ideal. And then just going through like their health history, figuring out like, what did their mother experience? What was their birth weight? What does their skin look like? So even though we're on telehealth primarily, we do run through all the systems to see like what signs we can find that are indicating the beginning of chronic disease.
Yeah. And so if you can tell me too, what are some of the things that are tested in that basic hormonal profile? I'm assuming you're testing estrogen if you're testing on like day 3, 4, 5. What are some other things that you're testing on those days?
Sorry, my earbuds keep falling out.
Oh, it's okay.
Yeah, so we are testing FSH. We do a pooled TSH value because we know that the TSH is always pulsing. So we draw 3 different values 30 minutes apart. We do the prolactin 30 minutes apart as well, times 3 to get a pooled value, since that's a pulsatile one as well. A really important lab that we draw is the OGTTI, so oral glucose tolerance and with insulins. So what we're doing is drawing glucose and insulin every 30 minutes over a 2-hour period with the 75 grams glucose to give that stress test, if you will, on your insulin response and glucose management. And what we found is that drawing it every 30 minutes, we're able to capture the curve of a lot of like a broader population. We're able to capture the diagnosis of insulin resistance sooner. And then also just seeing the relationship of the insulin as well as the glucose together tells us so much about what stage they might be in, whether it's, their insulin is still being managed, but the glucose is really high. But then as maybe it progresses, the body is no longer producing the adequate insulin to manage that high glucose. So yeah, it gives us a lot of information there. Emily, am I leaving anything else out?
Well, yeah, really the BHP, it's been crafted in such a way that when we run this, we're able to identify most of all hormonal imbalances, like get to the root just based off of, the values that we get back. And that in conjunction with Emily mentioned the like health history portion of things. I think patients a lot of times when they come to us, they're a little like taken aback in a positive way that like, wow, that my doctor is spending so much time with me and they're really listening to me. They haven't sometimes gotten that experience in the past when it's like, oh yeah, I have irregular cycles or I'm always bleeding or I'm never bleeding, acne, whatever it is. And oh, okay, well, here's birth control and asking nothing about health history, nothing about getting to, yeah, as you know, Haley, yeah, like the root cause of these different issues. And so yeah, our providers go really into depth on the history there. And then of course, yeah, with us being telehealth, then yeah, grabbing these labs are a really valuable part. And so yeah, there are like Emily said, it can be sometimes more or less, that 16 or so. But yeah, she listed those most important ones that get to the bottom of things, especially with us seeing so much insulin resistance right now, PCOS. Yeah. So yeah.
Yeah. That is truly amazing, because that's clearly not just a go to your LabCorp or wherever you go and get your blood drawn. Like it sounds a lot more detailed than that, which is great because you're getting that really detailed information. And I'm assuming this is like right off the bat. This sounds like something that you're like everybody gets. Is that right?
That's right.
That's correct.
Okay. Yeah, that's truly amazing. So when somebody goes through that hormone profile, actually, hang on. Before we get that, I'm kind of jumping ahead. So let's say we have a 22-year-old girl and she's not married. She's not planning on getting pregnant anytime soon, but she has irregular cycles. She wants to chart her cycle. She goes to the app store and she, by the grace of God, finds FEMM. She starts learning about FEMM and learning about her cervical mucus, all of that. And she starts to realize, oh, irregular cycles are not normal. And so she looks a little bit further. What would things look like for this girl? Like, would she just go on the website and find any provider at all, or like walk me through that? Like, what does that process look like?
Yeah, that's a great question because with telehealth, it's a little bit different than, of course, just like going down the street to your brick and mortar
Right.
and then there's that and whatever. So yeah, with telehealth, we So we're currently licensed in 43 states. We have 12 providers on our telehealth platform. And I maybe should make that distinction as well. We educate doctors, physicians, clinicians all over the world. So there's many, many doctors who are trained in our protocols from the RHRI, like Emily mentioned. However, we have 12 providers at this moment who are on our telehealth platform licensed in various states. And so, and counting. Really, that's kind of what and Emily's role, what we're focused on right now is this, adding providers and licenses to provide greater access to this care and availability. So, and really the telehealth portion that answered a big access question for us, seeing if that was a successful model, which it is what we found. And so, for this 22-year-old woman, she can go to our website, and when this podcast is being recorded, we're revamping our scheduling process at the moment, but she can go to our website and find the provider that is licensed in her state. And we currently have information we'll take and get her scheduled with the appropriate provider, and that's but everything's on our website.
Okay, so do you guys teach the FEMM protocols to other providers that are not necessarily networked with you? Just is that what I'm understanding? Just to get this information out there. Is that right?
Exactly.
Yeah.
Okay.
Maybe to paint a better picture of that too, we have our annual medical management conference that happens in June in Columbus, Ohio annually. And we have doctors from Tanzania, Malta, Croatia, all over the states as well, coming in to learn these protocols. And then they take them to their own practice and implement them, and then they get support afterwards. We have case studies and these sort of things to support them afterwards. But and then our telehealth platform is US based, and so all of those providers are currently just in the US in those 43 states.
Okay, gotcha. Yeah, I find that it's a twofold, right? We got to teach the women, right? Because we need them to know their bodies and to be empowered with that information. But we have to teach the doctors too, because this is not, I mean, I have talked to enough doctors and med students now to know that even just the thought of going back decades, just natural family planning, that in and of itself, they get maybe a slide of it on a total what are contraceptives slide lecture. That is all that they are learning in med school about any of this. And as we all know, the second you start looking at cervical mucus, you just dive deeper and deeper and deeper into more and more information, and there's so much to learn. So I think it's great that it's twofold. We're teaching the women to be more empowered by understanding their bodies well, and to get that help they need, but then also educating the medical side of things to not just have birth control as their offer, right? To actually get to the root cause of what's going on there. It's amazing what you guys are doing.
I want to interrupt this episode to tell you about We Heart Nutrition. This is a company that is family owned and offers wholesome, research-backed supplements for both men and women. Their products are crafted with integrity using clinical doses of research-backed, most absorbable forms of each nutrient. And what I love most about this company, you guys, is that it is pro-life. 10% of every sale they give to the pro-life cause and supporting pregnancy care centers. So it's amazing. This is definitely a place that I want to support. So I have been taking the prenatal vitamins and their magnesium supplements. And first of all, I feel like I'm just in a season of life where I'm just always taking a prenatal, whether I'm pregnant or nursing or preparing for a pregnancy. I really love that I am taking a prenatal that I can trust, and also the magnesium helping with good sleep, especially when I have those babies waking me up during the middle of the night. So go to weheartnutrition.com and use the code TRUTH to get 20% off of your first order. That's code TRUTH for 20% off your first order. I know you're going to love them.
We're finding that's what women really want. Of course, they want their symptoms addressed, but they also want to understand their bodies, have informed consent so that they can really be informed like participants in their healthcare and active participants. So yeah, that's really what we've found. And yeah, then having a doctor who can really help get to the root of those things has given, I think, a lot of hope to a lot of women, some relief. All of those types of emotions, I think, probably come to mind.
And I would say it gives so much hope as well to the medical providers and clinicians. One of our providers on our platform, she said it so well. She said, FEMM gave me my love of medicine back again. She said, if it wasn't for FEMM, I would have just burnt out, because I think these clinicians are excellent human beings with great intentions, and some of my friends, actually, that I remember talking to one of my friends who just finished his residency in Houston, and he read this book called This Is Your Brain on the Pill by Sarah Hill.
Yes, love that book. Oh my gosh, I love that book.
Excellent book. And I love that it emphasizes like the mental health aspect too. That is like so huge. But yeah, he was just like, Emily, like I have learned like every detail, black box warning of like a certain antibiotic. He said, but I've never heard any of this stuff. And now he's just so excited to learn. He wants to become a FEMM educator himself. And I was like, okay, well, maybe you should learn the protocols and let someone else be an educator just to, manage your time. But yeah, so I think it's such a big part of this education is getting it out to these wonderful clinicians who have a big heart, but have been also deprived of this knowledge, just like the women that we serve.
Yeah, absolutely. So I have to ask this question because there's so many women that are like, okay, I want to learn more about my body, but there seems to be a lot of different routes to go down. And so why would FEMM, and speak as lovers of FEMM, okay? Why would FEMM be the one that I should choose? Like, what is the benefit of FEMM maybe over others, right? Like, why should I choose FEMM to go down this route to understand my body better?
Yeah, Emily, do you want to go? Or?
Sure. I think, well, I'll share what I love about FEMM is I do feel like it is so approachable. Yeah, like we talked about the app, how there's just a lot of information on there that is really offered in a simple way for anyone to pick up and understand. The goal is for this education to be accessible to everyone and anyone who wants it. And so that really is the goal here. And I feel like when someone picks up the app, it's, oh, okay, yeah, I can start to look for dryness. I can start to look for that stretchy, slippery, clear. Oh, okay, like, yeah, bleeding, I understand what a light day is or versus, spotting and these sort of things. And so I think the approachability is something that comes to mind for me. Yeah, Emily, you have what would you say to that?
Yeah, I mean, I would echo that too. I did try a couple different methods for myself. And just at the time, I didn't really understand how important it was to understand this, to start this health journey. So there was a little bit of a barrier at first for me doing a little bit more in-depth methods that had a higher barrier of entry. So FEMM really just opened the door for me to really learn about my cycles, and then also the pathophysiology behind it. That gave me so much of the why. But then also as a nurse, I think my world was just totally blown away when I saw that there are total body systems being impacted by these conditions that are impacting your ovulation. So it's really not just about the fertility aspect. The fertility is like the best sign that tells you what's going on. But I was just so excited to find that we're trying to get to the root cause that's impacting the whole body, and that's going to affect the lifespan. So,
Yeah.
Yeah.
And to piggyback off of that too, that when someone does meet with a FEMM teacher, the education, the sessions do such a good job, I think, of relaying that to the student. That was one of my favorite slides in the sessions, is how it explains, it's a graph of estrogen and progesterone, and how those two hormones in fact impact almost every system of the body, the brain, the bones, like you name it. And it's, if those hormones aren't firing sufficiently when they need to in the cycle, it gives a very plain picture of like these systems aren't going to be going well, and this is why you aren't feeling well. I think a lot of things like click in the sessions for students, girls as well. So
Yeah. And I find that really interesting because as I think Emily Cosgray, I think you said it, that fertility, when somebody is sick, fertility is usually the first to go, because the body is really trying to just keep you alive, and fertility is primarily meant to keep somebody else alive, right? To actually make a
right.
new human being, right? And so that's would make sense why that would be the first thing to go. But as Emily Bostard, as you just said, estrogen and progesterone are so vital. Like ovulation is so vital for the health of the rest of our bodies. So I think it's really interesting that is the first thing to go, yet that is one of the most important things that keeps our body going. So do you guys have anything to say like on that note of, I don't know, I think I'm just making that click right now of like how interesting that is, where as much as it is the first thing to go, it's also so vital for the rest of our bodies. I don't know. What do you guys have to say on that, if anything?
100%. Yeah, 100% agree with that. And that's the motto of FEMM, is that ovulation is a sign of health. And that, yeah, it's just critical for every body system impacted by those hormones. Really, it's a cascade of hormones, and we want all of them in their proper order and amounts. And yeah, also just going deeper into that on just for me, what's so interesting is how it impacts brain health, and especially in adolescence. So that's something that I've learned a lot about in the master classes that I've been able to audit, is just how a properly functioning ovulation process in someone's body is critical for the formation of the neuronal pathways for these young women, and understanding that they're in an organizational window in their adolescence. And so at a time when like so many young women are being put on birth control for acne, and what, very good reasons for them at that moment, but without fully understanding how critical ovulation is for their health right now, but also for the rest of their life. Because what we've come to understand with this research is that these hormones that are being released throughout the body during adolescence are totally shaping the organization of the brain. And then that organizational window does close. And it has implications for the rest of her life. So that was also something that really was a hooker for me to get in. I was like, this is so critical, to spread this information.
Yeah. Yeah. Oh my word. I just did a podcast I was interviewed on another podcast, and we were talking about this exact topic, because for me, I have my own story too of being diagnosed with PCOS and having been put on the pill at 16 because of irregular cycles, and not until later on actually diving in deeper, understanding I had PCOS and actually getting healing from there. But I remember one of the doctors, just mainstream doctors that I saw, I was 18 at the time, not intending on getting pregnant, not married, like just having irregular periods. And she asked why I didn't want the pill. And I said, well, I mean, I'm not ovulating regularly, and the pill isn't going to help me do that. And she said, oh, well, why do you want to ovulate? And it's just this idea of like, our culture has taught us that ovulation is really only important if you want to get pregnant. Like
Yes.
that's the only purpose of it, right? And that's what she was taught in medical school. And so that's what she's going off of. And so that's why this is so important, that we're teaching women why ovulation is so important, but we're also teaching the doctors why it's so important too. And then, and then building more protocols, building better root cause protocols for proper diagnosis and treatment from there. It's so important that, yeah, especially to getting to the younger generation who like, why do I need to ovulate? I'm not trying to get pregnant right now. Like, what is the purpose of that? But as you just said, like estrogen and progesterone are so important for our brain. It's important for our bone development. It's important for just every system in the body. Yeah. Oh my gosh. I'm getting on my soapbox, you guys. I need to hop off of it now. But
I love it. We're gonna hop on it with you. Yeah.
Yes. Yeah. Yeah. Oh my word. Yeah. No.
Yeah, because that's really, like why we love working with younger women, to really like catch these things early instead of like, oh, let's wait it out. Let's see if it, fixes itself and that sort of thing. Well, maybe there's a time for that, but a lot of times, like, no, we need to get to the bottom of that so that then she can live a long and healthy life, and, then become a grandmother at some point, and these sort of things. And yeah, and could mention here too that we our medical providers are like equipped and ready to care for women, girls from puberty to menopause as well. And because in all the stages, and so really for a woman, if she's in her reproductive years, she should be ovulating. There's only certain times in her life when she shouldn't be, pregnancy, breastfeeding, these menopause, these sort of things. But outside of that, if we're not ovulating, then something's wrong. That sensitive biomarker is giving us some red flags there. And so it really does go hand in hand. We need the education, but then we need the support on the other end to catch us when we need it. And so just echo that. That's we see the importance of it with you, Haley.
Yeah. I also think too, you mentioned earlier having a low barrier to entry. I think that is so important, especially for that young adult woman who's like maybe on the fence of like, should I go down this rabbit hole? Like, this is knowing that it's a journey of trying to heal her reproductive system, but she hasn't been experiencing years and years of infertility. She hasn't, maybe it's not, the symptoms she's experiencing aren't super life altering, but in her gut of guts, she knows that something's off. And so having that low barrier to entry, like just stumbling across an app and then getting the help that she needs from that, I think is so just, it's amazing what you guys have built to be able to do that, because there are methods, Creighton included, that are maybe a little bit higher barrier to entry. And I see the merit in that. I think you can argue both ways of, making sure, I won't get into that, but there's pros and cons to both. But I think especially when you're trying to get to the younger generations, of helping them understand why their fertility is important, even when they're not trying to get pregnant, a low barrier to entry method is important. And so I think that is something beautiful that FEMM offers, because first of all, it is an app. Everybody and their mother now is wanting an app. Everybody wants, the amount of people in the Creighton world that ask for an app, and I'm just like, just stick to the paper, like just because that is the best that Creighton offers. And I think that there is merit to that too. I still chart on paper just because I'm a paper person, but so many women want an app. And your guys is one of the best for sure. So I think, if not the best. So I'm a huge fan of that being a low barrier to entry, especially for that time in life. And is that how you got, well, no, I guess you already talked about how you guys came across FEMM, but is that something that, like, actually, let's talk about the app for a second. What does it look like? Like, what does the app offer if you're kind of just stumbling across it in the App Store?
Yeah, I'm like opening my phone to peek at it. Let's see. It's really pretty. Go ahead.
Yeah, nice and purple is what I was gonna say there. Yeah. Our FEMM purple. Yeah. And yeah, so on that main page, yeah, you get to see these different markers of bleeding or cervical mucus, because really in a day, right, we're going to be observing one of those, even if it's nothing, which would be dryness. And on that main page too, you can always fall back on next to these, like next to the bleeding and cervical mucus, there's a little eye that gives you a lot of information about, oh, a light day, this is what that looks like, and kind of helps you pick a button on each day. And there's many other options here to pick, marking intercourse, LH, pregnancy, BBT, these different things, and then physical and emotional symptoms as well. And all of those are uh, observations that you can then export to your FEMM teacher, your medical provider, and even if it's not a FEMM provider, exporting it to them, and that can be really valuable information for them. Yeah.
Yeah. That is awesome. Yeah.
Yeah.
And sorry, go on.
Oh, I was just going to add that there is also an option to customize the app. So you can put it down for like, I'm trying to achieve fertility or avoid fertility, or I'm just seeking my health. And then you can also remove portions of it. So if you're like a mom of a teen and maybe you don't want that intercourse option listed there, you can just remove that, no problem. And so it really does just suit whatever is appropriate for that person's life stage.
Okay. And I have to ask, does the app have a predictor part of it? Like, does it predict anything about what your cycle might look like, or like when ovulation might happen, or is that completely off the table and it's just like data collection?
In terms of predicting when ovulation will happen, that has not been anything that I've seen on the app. It does have daily insights, but it's really just based on what you're plugging in there, telling you, if you plugged in a dry day, oh, maybe your progesterone is higher than your estrogen, that sort of thing, which it would be if it truly was a dry day. And then you can customize it with like your goals as well. So, it'd be different if, maybe you were charting a stretchy, slippery, clear type of day, an estrogen day, and okay, this could be a time when you might be preparing to ovulate. So if you're trying to achieve pregnancy, it would give you one thing versus another. But nothing to, predict the onset of ovulation, because I mean, it really, for women who have irregular cycles or, are bleeding a lot, or, they're outside of these normal ranges, it will flag that too and kind of give them like, hey, like, you could be a good candidate for medical management, and, for, and women, finally do, oh, maybe I should listen to that. And, then they, seek the care. But
I love that. That's a question that I'm asked a lot, is like, okay, what are some of the things, like, can you look at my chart and tell me if I'm okay? Like, tell me, like, do you see something wrong? Do you see, and I can do that, and I can help, help guide them to understand, okay, what a normal chart looks like, or what a normal cycle looks like. And then if their cycle is showing any red flags, but having something that automatically tells them like, hey, this bleeding right here, that doesn't quite make sense, that would be some reason to go see a doctor. Like that, I think is so, oh my gosh, I love that so much. It's just so empowering. Like that is answering the question that these women are having, is what do you see on my chart? What do you see on my cycle that could be pointing to something off? So I love that it kind of flags that and tells them, hey, by the way, this doesn't look quite normal. Let's get you in to see a doctor and get that figured out. I really, really love that. Yeah, that's phenomenal. Well, as we are toward the end of our time, what for our listeners that are listening right now that are obviously, of course, at this point loving FEMM and they want to check it out and all the things, what is some of the last stuff that any last things that you would want a listener to know about FEMM?
Yeah.
Go ahead, Emily.
It's a good question. Yeah. I think FEMM, we've talked about the different aspects of it. I think what I'd like to share is, for a woman who feels like, or a girl that feels like, oh, okay, I'm dealing with these symptoms. For maybe a teen, oh, it's acne. Maybe it's these different things that are really affecting, her confidence, just how she shows up in the world. That really there is help for that. That may be a common experience amongst you and your friends, but it's not necessarily normal. That's actually a great thing for us to recognize and identify, so that we can now get to the root cause. For a woman who, oh, I've always dealt with really painful periods and that sort of thing, and my mom always has, and my grandma always has, had as well. And okay, well, that's not normal. We know this through the research, we know this through the science, and so now we also know how we can get to the bottom of what's going on, so that then that can change for your daughter and your daughter's daughter. So I think, those are some of the things that I'd like to mention. Emily, what about you?
Yeah, and then just the education aspect, I think, is that's the first thing in my mind. It's more than fixing a problem that you may or may not have with your health. It's a celebration of how incredibly beautiful and phenomenal your body is. And I think it's so great for any and every woman to seek that knowledge, to be able to know herself more fully, and to just celebrate like how wonderful it is to be a woman. I was giving a talk and talking to someone that said, oh, sometimes I don't chart for life. Like, it's just, just do it when you need to. And I just thought, no, like I love knowing where I am. I love knowing what I'm experiencing mentally and physically. And I think it just is such a great way to help women respect themselves and honor their body.
Yeah, absolutely. Yeah, well, this is amazing. I thank you guys so much for this conversation. I've learned so much about FEMM, and I'm excited to teach more people about it for sure.
Yeah, and
Thank you so
Haley,
much.
can I mention one more thing?
Yes, please do. Please.
We are going to be at Seek in Columbus, Ohio. We're going to have a booth. So yeah, if anyone, I don't know when this will air, but if it is before that point,
yes,
we'd love to see anyone. Yeah, that's
yeah.
there.
I'm so glad you mentioned that. Actually, I'm going to be at Seek too, but I'm going to be at the Denver one. So we're covering all the bases.
Yeah, that's
so
good.
Unfortunately, we won't meet each other there. But yes, for those that just want to learn more about their fertility, if you're at the Columbus one, you can see these lovely ladies. If you're in Denver, you can come see me and learn about your fertility. Either way, come to the Seek conference for sure. I think this is going to air like right before the Seek conference, but for those that are on the fence. That's awesome. All right, you guys. Well, thank you so much for the conversation.
Thank you, Haley. It's great to meet you.
Thanks for listening to the Truth and Fertility Podcast. If you are enjoying this content, please leave a 5-star review. That helps me tremendously. For more information about learning to chart your fertility cycle, you can visit truthandfertility.com, and I'll talk to you guys again next week.